Essentially, the project that I presented during the Congress is a summary of the main findings from a recent paper from our group published on Nature Cancer at the beginning of the year. And what we saw in this project is that studying T cells in the blood and the cell-free DNA from the blood of melanoma patients receiving immunotherapy, we were able to identify an immunosignature that can discriminate the patients who are going to respond to treatment and who are not going to respond to treatment. And this immunosignature takes into account both the repertoire of the T cells and the phenotypic subset rearrangements of the T cells in the periphery. And one of the main clinical implications of the study is that all what we studied can be obtained from a sample of blood. So it's a minimally invasive liquid biopsy and could potentially help clinicians to better stratify patients early during treatment to understand if they are responding or not to therapy, and eventually decide early on during the course of therapy if it's better to move them to some other therapy if they are not responding. And there is a lot of work to be done in terms of clinical validation of these findings, which will need to be validated in more cohorts and will need to be qualified formally for clinical development. But I think it's a very interesting field, and I expect we will see a lot of developments in the next months and years, because it's, again, it's a very promising field.